and this is the traditional time for our case study. And so every year now for, I believe this is the 4th year, we presented a case study of a zoonotic disease issue or outbreak in order for you to participate in helping us solve it so that you stay awake in the postprandial slump. So I'm Eleni Galanis. I moderate this session as well as present some of the information to help you in your deliberations. I'm a physician epidemiologist at the BC Centre for Disease Control, and I work on the surveillance, prevention, control of infections, including enteric infections and zoonotic and vector-borne infections. I'll be joined up front here in a minute by my co-presenters and the people who helped put together this case study. Dr. Charmaine Enns, who's a medical health officer with Vancouver Island Health. Dr. Theresa Burns, who's a veterinarian epidemiologist with the Center for Coastal Health. Natalie Prystajecky, who you met earlier. She's with the Environmental Microbiology Lab at the BCCDC Public Health Lab. And Lorraine McIntyre, who is a food safety specialist with Environmental Health Services at the BCCDC. Jackie Plamondon also helped create this case study. She's with the Canadian Food Inspection Agency. She's a regional inspection manager, but she couldn't attend today, so I'll be presenting her slides and her content. And so let us proceed. What we'll be talking about is providing you some background information about norovirus in humans, norovirus in oysters, and how that norovirus can infect people through consumption or other contact with oysters that may be contaminated. We'll then talk about the 2 waves of an outbreak we experienced last winter. Dr. Charmaine Enns will present on the Tofino outbreak, the outbreak that occurred in a small town on Vancouver Island. And then myself with Natalie and Jackie will be presenting what happened to the rest of the province and the rest of the country in the months following that. Lorraine will present on work that was started following the outbreak to try and understand the environmental source of contamination. And finally, we'll close with some thoughts around how do we prevent this in the future and what are the next steps that have been planned to control these kinds of outbreaks in future. And so each of us will present some information to you, and we'll pause 4 times with questions for you to discuss at your tables, or if your tables are too small, to discuss with your neighbors to come up with some answers. And then we'll compare notes to see what we had come up with during the investigation. There is no right answer. All answers are welcomed. This was the reason we present this outbreak is because it was a real challenge for us to both investigate and to control. So your thoughts and your opinions and your experience are welcomed to help us prevent this in the future. All right, I wonder if we can turn this. Yeah. So norovirus infection in humans norovirus is a virus that's transmitted from person to person through the fecal-oral route. It is the most common gastrointestinal infection in humans in Canada and North America and in most of the world. The incubation period is very short. It's 10 to 50 hours after exposure that one becomes ill. It causes vomiting and diarrhea, and in some cases dehydration. It rarely causes severe enough illness for hospitalization, extremely rarely causes death, and if it does, it's usually in very vulnerable people like the elderly or the very young who can dehydrate more quickly. It self-resolves in 1 to 3 days, but it's highly, highly contagious, so it's easily spread during that time to other people in close contact. The usual season is from November to March. It occurs during the same months as influenza, and when we talk about flu, is it me? Thanks. So it occurs between November and March, and you'll see there a graph of the number of outbreaks that were tested positive for norovirus in the preceding years, and you see there that there's a real seasonal pattern. It's not a reportable disease in BC or in most of Canada on a case-by-case basis, but it is a reportable condition if it occurs in an outbreak setting or if it's believed to be foodborne. Norovirus is well known to cause community outbreaks, usually in closed settings, in households, of course, but also in schools, in long-term care facilities, as well as in hospitals. And it can lead to closure of those facilities or closure of wards. So it has a huge impact on hospitals during the winter season. Foodborne outbreaks are usually caused by ill food handlers. So someone who becomes ill through community contact or community exposure, then works in a restaurant as a food handler, as a cook, can transmit norovirus through contaminating the food that is ready to eat, and other people get infected through that route. But food contamination at the source is very rare. So it's rare that norovirus gets into the food while it's either grown or produced. And although it's possible, that's unusual. And so in any given year, the BCCDC usually gets 0 reports of foodborne outbreaks, or specifically related to the consumption of oyster during a winter season. So our baseline is 0. Now, however, we do have outbreaks on occasion, and there have been 2 documented outbreaks of norovirus infection caused by the consumption of contaminated oysters. The first was in 2004. There may have been others, of course, but these are the ones that have been documented. And this was very similar to what we experienced last year. It was caused by, we believe, widespread contamination of shellfish farms across much of the growing areas in British Columbia. And it caused cases or infections in all parts of the province, as well as concurrently in Washington and Oregon. In 2010, we had another reported and documented outbreak, which was a much more traditional norovirus foodborne outbreak, and that was also caused by the consumption of oysters consumed at a limited number of restaurants in British Columbia. I think they were mostly in the greater Vancouver area, and that was traced back to a single oyster farm where one of the harvesters was ill with what was likely norovirus and had accidentally vomited in the shellfish beds. Lovely thought, yes. So how do we investigate shellfish-related illnesses? So when, this might be a little paler, so I'll read it out for you. When someone becomes ill, either a single person or a group of people, we call them clusters of people become ill, after eating shellfish, and they report it. They either report it to the restaurant because they're upset, and that gets reported to the local health authority, or they report it to a physician or directly to the health authority. Then those people who are ill get interviewed by an environmental health officer in the local health authority. If there is a retail or restaurant identified as a source of shellfish, that premise gets inspected by an environmental health officer. And the purpose of that is to identify any reason for contamination at the restaurant and to collect tags. The tags are the piece of information that comes on the net in which the oysters or other shellfish are transported. And it contains information to be able to trace back the oysters to the processor and to the shellfish farm. And so the tags are collected and they're sent to the CFIA, the Canadian Food Inspection Agency, where they determine whether an inspection and a review of documents at the processor is required, and further upstream whether an inspection or testing or other investigation of the shellfish farm is necessary. Over to you, Theresa.
Okay, so there's about 9 species of shellfish that are grown commercially in British Columbia. And a snapshot of the BC shellfish industry. There's about 450 licensed growers in British Columbia, but many of the farms are not active on an ongoing basis. Many farms are smaller, ma and pa type operations in remote rural locations where people have moved to a pristine environment and they do some shellfish culture to supplement or gain some small income, although there are a handful of large sort of commercial producers. The Pacific oyster is the most important species of shellfish cultured in British Columbia, and so They're sold both raw for eating on the half shell, raw oyster bars, as well as for cooking. And the oyster industry is worth about $14 million on farm gate sales, and that compares to salmon at about $700 million and chicken at about $400 million. So quite a small industry, but a place where people living in remote rural locations can generate income. And so this is a map which shows where the shellfish farms are in British Columbia. Whoops. Uh-oh. Is there a pointer? There it is. So Vancouver Island, this is the Bain Sound area, which is the most important shellfish growing region in British Columbia. And that's the area between the east coast of Vancouver Island and then Denman and Hornby Island. And you can see over here that there's a lot of farms clustered close together in that area. And then up in the Discovery Island area, a little further north, and there's some farms along the west coast of Vancouver Island, and then a small number of producers up in Haida Gwaii. So norovirus in shellfish. Norovirus can accumulate in oysters, mussels, and clams as the shellfish filter water, which is how they feed. But in oysters, interestingly, the oysters in their tissues have a homologous molecule to the one that binds norovirus in the human gastrointestinal tract. So I don't know why that is, but for some reason, oysters are very efficient at binding norovirus into their tissues, and particularly norovirus G1 strain. So oysters are very good at collecting norovirus G1 in their gastrointestinal tract, and it's hard to get them to release it. You're using purification methods that are good for removing other types of potentially foodborne illness pathogens from oysters. And it can stay in the oyster for up to 10 weeks, and it does not make the oyster sick. So the shellfish aren't affected by norovirus, they're simply bioaccumulators that can then make people sick. And interestingly, a 2-inch oyster filters a lot more water in a day than a clam, or so as well as being good at accumulating norovirus, they're also having a higher throughput than other shellfish, so they're at a high risk for being contaminated. And so norovirus in other sea animals, this is a little bit of background for some of the questions that we'll need to face later on. So there's limited data about norovirus in other sea animals. There's a little bit of work showing that it was found in some sea lions, and one study that it was found in a harbor porpoise, and none of those animals were sick from norovirus, and the norovirus was genetically quite different from the norovirus that's found in people, or somewhat different. And so I'm ready to move on. Is it Charmaine next? Oh, there you go. Sorry, Natalie.
No problem. Good. Thanks. I will talk to you a little bit about how we do norovirus testing in humans from a surveillance perspective, lab diagnosis and surveillance perspective. And so the average person who comes down with a norovirus infection is not really eligible for routine norovirus testing. And that's because the BC guidelines for testing for stool pathogens really suggests a longer duration of infection that doesn't really include viruses. However, if a case is related to an outbreak, that certainly falls into the parameters for routine norovirus testing. We also do testing for high-risk populations, pediatric patients, those who are immunocompromised. But for the average adult, they would only be able to have their stool tested for norovirus if they were part of an outbreak, or suspected part of an outbreak. There are norovirus testing services across the province in a number of the primary care facilities and hospitals, but the majority of the community-based testing does happen at the BC Centre for Disease Control. And we use a method where we can test for vomit and stool, and we extract the norovirus on an automated extractor called an EasyMag, and you'll see why I'm telling you all these details in the next slide. And we use a real-time or quantitative PCR that is capable of detecting both norovirus genogroups 1 as well as norovirus genogroup 2, and they're based off of a publication out of Japan, and they're called the Kaya Gamma primers. And this is the same set of primers that are used by most public health labs across Canada. And likewise, the CaliciNet, which is a network of norovirus testing laboratories in the US that's led by the CDC, they use the same primer set. We use the exact same diagnostic assay as our counterparts in the US. And so for every outbreak that is positive for norovirus, we will sequence a representative sample to determine its genotype. So to get it down from just saying this is a G2 to be able to say it's a G24. And we do that using a type of sequencing called Sanger sequencing. It's not as cool as whole genome sequencing, but it really is the basic of a lot of genotyping and work that we do in our lab. And we have also just started to sequence the polymerase gene as well, because there's evidence now that there's a lot of norovirus recombinants out there. And so we've evolved our methods to, again, match our colleagues in the US, but to do a better job of describing the norovirus strains that we see in British Columbia. Now, this is information that Katie Eloranta from CFIA provided me with respect to the details on what they do for shellfish testing. And so they do the norovirus testing in the CFIA labs. They do it here now in Burnaby. They also do it at the St. Hyacinthe lab in Quebec. They test oysters, and usually they like to test 6 to 10 oysters. And you'll hear, they sometimes will do testing of fewer oysters if it's part of a public health investigation. So not testing necessarily at production, but maybe testing sample from a patient's home. They also use the EasyMag, and this is an ISO method. And they're also using the Kaya Gamma primers, and this is in the Health Canada compendium. So we're pretty much doing the exact same kind of work. There's some slight variations because theirs is a food sample, as opposed to ours being a clinical samples. Their viral loads are much lower in food samples than in a clinical case, but basically the same techniques are used. The only difference really is that they confirm every single one of their cases by Sanger sequencing, like we do Sanger sequencing too, but for their purposes, they are doing it for confirmation, but they don't yield enough nucleic acid to do the genotyping. So the oyster load in an oyster is much lower than in a human clinical case, and so there's not enough RNA to be able to do genotyping. And lastly, you may have noticed that I had mentioned that our assay is specific to genogroups 1 and genogroups 2, and there's a specific reason for that. So a lot of like other enteric viruses, norovirus is very host restricted. And so when you see someone come down with a case of norovirus, a human who has norovirus, they were exposed to someone else's human norovirus. They were exposed to somebody else's feces or vomitus. We don't see any zoonotic transmission that we're aware of at this point. There are zoonotic strains or other animal strains of norovirus, but the ones that cause infections in humans, predominantly norovirus genogroups 1 and genogroups 2, have not been found in animal species as far as we're aware, or a very limited amount of discovery, for example, in that harbor porpoise, for example. And so it is certainly a host-restricted virus. I think it's Charmaine.
Thank you. Okay, so I'm going to tell you a story. So a year ago this weekend, Tofino had its annual Oyster Fest. And I'm just going to stand over here so I can see. So the festival was on Thursday, the 17th to Saturday, the 19th. Tofino is a small town on the west coast, about 2,000 people. I'm a Tofetian, and I was at ground zero when this all happened. So it really did happen. Oyster Fest is a big deal because people come from all over, not only British Columbia, but other provinces and even the US. But I don't, oh, okay. No, so, I'm sticking on things. Okay, so there was about 500 to 600 participants at Oyster Festival that consumed over 11,000 oysters. So most of those oysters were raw oysters on half shell. There was a couple thousand shucked oysters in tubs, but by far the majority of oysters consumed were on half shells. There was two big events, two galas that brought a lot of people that consumed a lot of the oysters all at once. But there were oysters distributed throughout the community in multiple restaurants and other food premises that, because that's an Oyster Fest weekend, so that's the whole point, is that you can get your oysters. So, but the two gala events are quite significant. Some people consumed like over 50 to 100 oysters, one person. I don't know how people can do that. However, that's part of the story. So, The gala event was ticket-based, but again, people aren't registered and we don't necessarily know where people came from. So day one, and going forward, every number in a bracket means the day out from the initial day being Tuesday, November 22nd. So that's the day we first got the first hint that something might be happening in the community. So through the Environmental Health Office, through Public Health, and through the Emergency Department, we're starting to just hear a little low-key rumbling. Mind you, this is November, this is the neuro time. So again, just a bit of a signal that something might be happening, but nothing definitive. By Wednesday, though, the next day, social media started to just kind of light up with conversations about, hey, I'm sick, I have diarrhea, I was at Oyster Fest, where were you? Are you sick too? But all through the social media circles, nothing actually coming back to us, to the health system, or to people that could actually initiate something. It was just, again, that buzz and how everybody's connected to each other talking about it. So here's my question for your table. If you could take a couple minutes at your table based on this background, and as the investigative team, what is your strategy to identify the source of this illness? Go for it. How long did it have?
It's all your fault, it's mine. It's all of us together. All right. It sounds like a lot of the tables have had some good discussions. We'll ask that the groups come back to us and give us some of the ideas that you've come up with. And are there any groups that want to shout out some of the ideas that they've had? Charmaine.
So since there was a buzz on social media, our idea was that we would put a notice out on social media just asking people if you have any of these symptoms, please call a number, report it to us. And additionally, we thought maybe put some notices out on bulletin boards and things to capture those that weren't on social media. So then we could get in touch with people and start the interview process.
No, because I'll confirm what in my next slide.
Okay. The other ideas? Yes.
So our group said, so basically before we develop a strategy, we wanted to mobilize a team first. So most likely that would include epidemiologists, food safety inspectors, MHO, communication, and administrative staff, and any local contacts.
Thank you. You've gone to an outbreak investigation lecture. Anything else? So we've talked about case finding, about pulling a team together. I heard a lot more ideas at the tables. Anybody want to volunteer a few ideas?
Okay, great.
So we also came up with that one point would be to go back to the actual organizers, as they may have been contacted at that point already by someone who may have gotten ill at any of those gala events, and they may have some additional information. And then also getting the ball rolling on the social media as to getting people back involved into contacting the representative authority to start doing interviews, doing testing, and getting to an idea of, because we don't know if it's norovirus at this point even at all. We don't know what it is.
Yeah, good point. You can't make any assumptions at this point.
Yes. And there is also one physician that you had mentioned that already contacted, so he may or may not have some clinical samples to be tested as well.
She.
My table's being shy, so I'm going to nominate them to say a couple more things. They had some very... Can you hear? If there's any leftover oysters that could be collected. And also to begin interviewing workers and sick people, and to find out where people ate the oysters, where people who are sick ate oysters, to see if there is one specific focus or whether there's multiple venues or restaurants that might be involved. Oh, and other foods they ate. Now they're giving me ideas now.
Anything else? Final thoughts.
In a small community, there might be one medical center, and the emergency department could be a source for finding cases and getting specimens.
Good point. Yeah, and there is only one. Okay, so excellent point. So I'm gonna take you through what actually happened. Okay, I'm gonna take you through what actually happened, and just, I was heavy on the emphasis that this was an oyster festival, that people ate oysters. And I kind of did that on purpose because that's what everybody hears. And the fact is, like that comment about don't make any assumptions. So the same feedback to the team, the people doing the investigating, is don't get too narrow too fast. Don't make any assumptions. Just because it was an oyster festival doesn't mean it's oysters. So we have to do our due diligence in going through the steps appropriately, keeping an open mind, gathering the important and essential information, and then doing our interventions. So that was Tuesday, right? So Wednesday, we did start contacting the vendors, and because gathering samples can be a very time-limited thing, and in fact, it was very difficult to get samples because people who love oysters, and there wasn't many left. The local health, the physician in the community, again, there was a messaging going out to the few physicians in the community. But the reality is people with norovirus really don't attend healthcare very often, or if at all. So it was really more about notifying the lab if any samples come in that we wanted them, we wanted to collect samples if you have the opportunity to collect samples, and to let the labs know that we were looking for a potential outbreak. And of course, had the first conversation with BCCDC, so they were aware. By the next day, we formed our investigation team. Now let's just also remember that we don't actually have a standby investigative team. These are people who have full-time jobs doing something else, and there's a handful of people to be involved in any of this work. So our team is really small, and our team already has full-time responsibilities other places. So it's always a challenge when something new comes up on top of the regular work. What else can I say? So yes, we did start the really serious conversations with vendors, event organizers, and trying to gather specimens. And there was, and I was starting to get media requests. Now, what's interesting is that it became apparent that, in fact, we do need to channel the buzz on social media. And there was a communication sent out through our Island Health Facebook and Twitter feed saying, hey, if you were at the Oyster Fest, could you get in touch with us if you got sick after that event? There's also a very important network, a social network in Tofino that you have to be a member of, that I'm not, but my husband is. So he went on and let people know to contact as well. So it also helps to have local connections. And that really, just by doing those two things, the calls started flooding in to us in terms of reporting. So we also had I think, Eleni, you put out this CNPHI alert that day as well. I'm not sure how much that yielded, but it just was for information. So that day alone, just by that one mechanism to social media, we had 54 focus group interviews that day with clients, people. Okay, by Monday, I'll go through this a little bit quicker. A case definition was developed. We started to formalize our daily investigative team teleconferences to make sure that we were on track for doing what needed to be done. Also, by the weekend, I need to tell you, we had a number of oyster samples collected. We had tags collected. So we had already gathered everything we could from food premises that was still available. Then, so now you can see number 10 in the bracket. So this is already day 10 out. And now we've initiated the BC Foodborne Illness Outbreak Response Protocol. If you're not familiar with that, that's our BC guideline for multi-agency response to a foodborne illness. By this time now we had 126 cases reported. We know that actually underrepresents the number of people who actually got sick. We then move into going on site to harvest based on the tags and being able to identify specific land files and harvesting sites that we actually, with DFO, Island Health went on site to do some water samples at those land files. And on December 15th, so 26 days out, the first closure of a land file happened from oysters implicated in the outbreak. And that picture is just the number of water samples collected around an oyster farm, which has the cluster there in Lemons Inlet, which is right near Tofino. So in terms of lab testing, out of all of those cases, we only had 6 human samples. We had very few samples collected. It's very hard to get when you have a distributed affected population and somebody is calling you from Victoria saying, hey, if you've been sick, maybe you want to go get a stool culture done. People just aren't going to do that. So we got 6, which is great, and they were 6 positive. 5 of those were the genotype 1.2, and 1 was the 6. And interesting, there was a couple that were both affected, and one had 2 and one had 6. So the shellfish testing was trickier because we were able to get, the samples came back positive, presumptively positive for norovirus, and yet we weren't able to genotype it because we didn't collect enough oysters. So we collected about 12 oysters per landfile or per harvest site when you actually needed about 30 in order to do genotyping. So we didn't have enough oysters for genotyping. But we had enough to know that they were positive. What I just want to mention here is that at this point in time, we're now almost 1 month out from that point in time outbreak. We had some secondary cases, which I'll show you in a second. We're now 1 month out, and yet in spite of that, it took almost a month for the first site to be closed. And you know, in hindsight, that's just not good enough. And that took a month, even though we had strong epidemiological evidence, we had positive human cases, we had presumptively positive norovirus in oysters, and that still wasn't enough to push the regulators to a health risk assessment to recommend closure. So we've learned some things from that, and Eleni will be bringing those up. So the findings are, you don't want it. So we ended up with a total of 118 cases, lab confirmed or clinical. We had a number of clusters from within that Tofino area, and we also had a few red herrings that sent us off on a different direction, like there was a sick food handler at one of the large restaurants, and so people thought maybe it was that single affected that worker, but in fact it wasn't. We had a red herring there. And those things can send you off and take up a lot of energy but you have to deal with them. So this, just to finish off, to say that here's the epi curve, and you can see, you know, it's epidemiological, completely consistent with norovirus in terms of a point-in-time exposure and the clustering of cases over those 2 days. Okay.
Thank you. Thanks, Charmaine. So we were wrapping up the investigation. The 2 farms that were potentially implicated in the outbreak in Tofino had been closed when we started seeing new cases. So we were still meeting as an outbreak team, and on December 21st, there were 7 new clusters of norovirus-like illness for a total of 19 cases. So these were all from Vancouver Island. Their onset, though, was quite a bit later than the Tofino cluster, with the onsets being from December 6th to the 19th, and none of them had visited Tofino, been to the Oyster Festival or any of the restaurants, or had any links with Tofino, didn't know anyone who lived in Tofino. But all consumed raw or cooked oysters in the 10 to 50 hours preceding their onset. And the oysters that were identified in these clusters were different from the oysters that were identified in the Tofino outbreak. They came from different farms. At the same time that this was happening, of course, our norovirus season was in full swing. So we had a number of community outbreaks in different care facilities and schools. And there had been a lot of media attention, and continued to be media attention, on the outbreak that had occurred in Tofino, as well as the investigation findings that we were revealing, that Charmaine and Paul Hasselback, the MHOs in Vancouver Island, were sharing with the media. So a lot of awareness in the community. So your next mission, we actually had to grapple with this. How do you assess if these new cases, these new clusters of norovirus-like illness are associated with consumption of oysters, or whether they are just community transmission of norovirus? How did you differentiate the two? We'll give you 5 minutes.